Last week, I met two of the sweetest girls, sisters. I noticed that their last visit was 2 years ago. They had missed several appointments with their regular doctor. Given this pattern, I didn't really expect them to show up. But I was pleasantly surprised to see them standing right there before me. The oldest sister was a talker. She narrated every aspect of the day's visit. Despite the child's cheery and upbeat disposition, her caretaker had concerns about her. The caretaker explained that the child sleeps very little and has a hard time settling down to rest. The girl was also struggling academically. When I asked her caretaker if there had been any illnesses since their last visit, she responded with a bewildered expression. She shrugged her shoulders as if to signal that she didn't really know. Then the girl herself, the talker, immediately jumped in. She said, "She's not our mom. She's our aunt. We can't talk about it or she will cry. My mom died, but it's okay. It's okay." The aunt did, indeed, began to cry, her face completely flushed. The children rushed over to hug and to comfort her. This woman had lost her sister. These girls had lost their mom. Despite this tragic loss, the girls' growth charts looked perfect. There were no findings on the physical exam. The exam and history did not tell the whole story. These girls are at risk for poor health in adulthood. Their risk of poor health is due to the trauma they have experienced. Trauma was not an accessory to today's visit. Trauma was core to today's visit. The chief complaint was a well child check, but there would be no wellness without acknowledging and managing the trauma. As primary care providers, we are charged with recognizing the health risks posed by adverse childhood experiences, or ACEs. These ACEs can lead to poor adult health. This child's academic problems, inattention, and insomnia could be caused by ADHD or hyperthyroidism, but these symptoms could also be related to trauma. Not only are primary care providers charged with recognizing trauma, we should also acknowledge the preventive and healing effects of safe, stable, nurturing relationships. When children have at least one consistent, nurturing caretaker, they can be more resilient. They can flourish despite adversity. They can grow healthy. Thankfully, these children have an aunt who can provide a safe, stable, nurturing relationship. Yet, the clear look of overwhelm on this aunt's face is undeniable. How do I, as a pediatrician, provide the support that this aunt needs to remain a safe, stable, nurturing relationship? Can I provide resources to help this family move through their grief? Are they constrained financially? What tools can my practice have in place to lighten her load? Pediatric providers have a part to play. Let's fortify our practices with the tools we need to keep our little patients as healthy as possible. Tools like vaccinations, anticipatory guidance, and collaborative relationships with therapists and community resources. Let's continue to foster the safe, stable, nurturing relationships our families need to thrive.